Good evening. Welcome to CICM India, Chapter 2. I'm Sushmita Roy, the General Secretary of CICM Chapter 2, which began in 2019. Today I have with me Dr. P.P. Bose, who is the President Founder of SANS Foundation and CICM Chapter. CICM since 2019 has been continuously dedicating itself into professional development care, into respiratory and allied services. So it has been quite a journey, continuously training, arranging for workshops, and today I have Dr. P.P. Bose, who's going to tell us a little about the journey since 2019.
Sushmita, it's wonderful that to know that you are the part of this whole mission and vision of CICM. And since 2019 we started this whole process as a continuing professional development, which basically was focusing on respiratory and allied care profession. And who are these respiratory and allied care profession? Look, India is the you can say the capital of the respiratory disease in the world. We have tuberculosis here, we have viral diseases here, we have respiratory disease here, we have obesity here, we have a lot of problems even because of the pollution and population. Now what happens, the respiratory care practitioners are those people who are seeing respiratory patients. So we have general physicians also seeing respiratory patients, because the common general physicians...
So is it only the people, pulmonologists, or anybody else?
No, it's for everybody. That's why I'm saying that respiratory care practitioners could be a simple physician, could be a specialized physicians, could be a pulmonologist,
or a super specialist,
or could be a super specialist, or could be somebody who's related to critical care medicine, or it could be a rehabilitation person, or a nurse educator, or somebody who's doing an advocacy,
postgraduate student as
or
well.
could be a learners and everybody, and also the people who are taking care of this patient at the home care level, allied care professionals, or palliative healthcare workers, or anybody. So that's why it's a huge responsibility of a super specialist to connect everybody and disseminate knowledge the right way, so that the continuity in health career is possible with the right kind of knowledge and wisdom.
So Dr. Bose, in 2019, after the training, we found ourselves in thick of COVID, and this actually helped out reaching out to patient even as home care workers, right?
Absolutely. If you see the clinics in chest medicine, what we started, it was an initiative from our foundation, SANS Foundation, and an academic support from Forts. The whole concept is that, as I mentioned, the continuity in care.
Yes.
Now, when the COVID came, because we launched in 2009 with a lot of pomp and show, we are the best of the people.
Absolutely.
Everybody appreciated. In fact, this book was launched here.
Yes.
This book was the first book we launched.
So this was launched in 2019, right?
And this is basically a manual for chest diseases. And dear doctors who will be probably watching this show, they will say, why this book was launched. The reason being, it was made like a manual, so that everybody
I see a lot of graphics and a lot of...
It was based on graphics, key points and algorithms. So this was the whole concept of basically so that anybody could follow those basic protocols.
Okay. But then there's also this now, you have the manual on COVID, all that you have recorded, your experiences through COVID, a lot of data, a lot of graphics, and a lot of algorithms.
Sushmita, when this was done, we had the vision of doing a lot of those small workshops, hands-on experiences involving all the people relevant to respiratory care practitioners. In fact, we were doing a lot of good things. We were doing non-invasive ventilation workshop, hospital workshops. Then COVID came.
Yes, right.
So when COVID came, we didn't give up. We thought probably there's a time to help people. So what we did, we started a Fight COVID initiative.
And I remember the fact you said when everybody was in their homes closed door, you kept writing this, right?
Yes. So we didn't give up. We thought probably we are the front runners of respiratory practice in India. So our team worked because we had to work. But we took an advantage to learning new things, because most of the good doctors were not available. So based on an IHC experience in home care, we wrote this book called Manual in COVID. And we thought probably
such a hands-on guide.
Yeah, this book we are going to launch in our upcoming conference
on 5th November.
On 5th November. So this is the whole concept of dissemination of knowledge. Not only we want to stick to only a one forum, it will be continuity, so that through books and algorithms and those flowcharts they can develop and hang on.
The
So
very fact that CICM India has been so successful, there is professionals, professors and doctors who have come together sharing a platform on 5th November, and you have best of doctors as speakers.
Yes, we have the best of the doctors as speakers, and we took an advantage because now the COVID has come down. It's gone. The book will be an inspiration for people. So if in case there is an epidemic again, because this is a kind of ready reckoner, we have given a lot of inputs and algorithms. But the reason for doing the 2023 is something like 2019. We are planning it. We are connecting the best of the professors, academic people, and it's a very medical education basis,
Right.
and something like a Pathshala
Right.
we have created. What happens if you see the scenario, the postgraduates and the learners and those who want to do a good respiratory practice, they don't have much of opportunities in India, because for any good conference they have to pay, they have to travel.
Right.
Here it is
Right.
entirely
It's
for
free.
them. It is not only free, we are giving the books free, we are involving
In
them.
fact, it's like a Diwali bonus for
Not
the
only a
learners.
bonus, and also we are reaching out to different institutions. Like we have a couple of good institutions in India, like
Yeah.
Safdarjung, we have Maulana Azad, we have UCMS, we have got
Right.
ITRD, we have got Patel Chest, individual hospitals. So our team is reaching out to them on a one-to-one basis, and also give them a lot of small there's connecting.
I think it's a miracle that everybody decided to come together for once. And
Because we are taking a lot of
reaching out
initiatives
to the students.
to sensitize these
Yes,
youngsters,
right.
because last 3 years they could not learn. Imagine, like for example, if somebody is aspiring to be a good pulmonologist, and 3 years there was not much of learning because the COVID didn't allow them
Yeah.
to touch many patients.
Yeah.
So we have to really revive the whole education concept. As I mentioned, this is something like a Pathshala concept. It's like an hub and spoke. We'll connect the good professors with the youngsters, and also we'll involve the youngsters
And-
to disseminate their way of viewpoints, and that's why you see
And the latest technology,
Yeah, latest
the
technology.
AI into pulmocare.
Even if you see the conference, which is we are doing the 5th
Yeah.
November India Habitat Center, we have involved speakers in all age groups. We have
Yes.
young speakers also, we have very
Right.
senior speakers also,
Right.
and we have brought a lot of new topics. We have brought AI, we have brought
Mm-hmm.
on one side we have brought tuberculosis,
Right.
we have biologics in asthma, we have brought AI, because AI, without AI you cannot go to the
Right.
next wave. We have interventions. We have
And
brought
the
lung
guidelines
transplantations,
on-
we have
yes.
brought certain COPD guidelines.
Right.
The first time we are doing a rehabilitation of lung, where, we are creating a total platform where the rehab, pulmonologists and the lung surgeons will be handling one show. So it's a huge.
So you're taking the concept of Pathshala.
Yeah, it's
So,
Pathshala is something like a
sharing
guru,
knowledge.
sharing knowledge, and it has to be continued. So that once you give lot of hands-on experiences, once you allow the youngsters to share their wisdom and their experiences, so that they can take it forward, they can also get involved. So basically, these are for the future pulmonology. And This
Right.
is what we are talking about today and tomorrow pulmonology. We want to connect the youngsters and the people who are actively involved in pulmonology, so that whatever the learned wisdom they have, they can share with the people with the right kind of wisdom, with the right kind of knowledge and literature review.
Right. So it is taking them beyond books and beyond the pages into the reality, real world. Right?
Absolutely,
Through
beyond books. And if you
experience.
see, I think every doctor should go to our the website, the
Yes.
CICMindia.com, the clinics in chestmedicine.india.com,
Yeah.
and I'm telling you,
We'll put it below the podcast, right?
Yeah.
The
This is
the
clinics in
link
chest medicine
you can
India.
always
Dear
follow.
doctors, you must go through. The logo is very. What we have divided the website into an education, training, guidelines, and manuals, and advocacy. And this is what we call the continuity in professional development. As I mentioned, this is a basically.
Which is absolutely mandatory,
It's
imperative
mandatory.
in today's date.
Yeah, and also
Right.
if you see when you click it, and where we are giving an opportunity, you can become a member,
Right.
and also we have shared what all we have done in the past.
So if they become a member of CIC,
They get all the
India,
benefits.
Yeah.
They can get those listen articles, they
Right.
can share their experiences,
Right.
they can
And
share
the
their own
journals,
cases, the
articles,
journals,
yes.
they can be a part of it. And
Right.
the best part of it, the first time we are doing it, we are also running a fellowship courses where the respiratory courses have been divided into different modules, A, B, C, D, E,
Right.
different module, like critical care module, sleep module, rehab module, basic respiratory module, basic course, critical. So they can have those modules also as a part of their training model. And the best part of these fellowship courses are that the best of the professors are involved.
Right.
There are directing lectures. We are using
Right.
YouTube podcast, and
Yeah.
very simple. And the best part of it, we are not charging a penny for it.
Absolutely, not a penny. So this is on 5th November at the Gulmohar India Habitat Center. Please fill in the form and ensure that your participation is there during the program.
Dear doctors and young pulmonologists, anybody who's involved in the respiratory, this is a huge opportunity for you. Don't give up this opportunity.
Just don't miss
Stay
it.
connected with our team. Fill up your Google questionnaire form.
Right.
And we have very limited seats. You're already running short of the seats. Join us and enjoy the feast of
And for an enriching experience on 5th November.
On 5th November. Looking forward to see you on 5th November.
Absolutely.
And enjoy and happy Dashera. Regards, Dr.
Thank
Bose.
you. Namaskar.